Good afternoon, everyone. My name is Sten Vermund. I am proud to serve as the Dean of the Yale School of Public Health, and I'm delighted to welcome you to the Global Health Conversation Series, sponsored by the Yale Institute for Global Health. This series is a venue for our community to learn from and connect with innovative leaders in global health. In addition to YIGH, we're indebted to the George Herbert Walker Jr. Lecture in International Studies at the Whitney and Betty Macmillan Center for International and Area Studies at Yale for co-sponsoring the series, including today's event. So it's a pleasure to be with you today and to introduce our speaker. Each year since 1988, on December 2nd, yesterday, we've commemorated World AIDS Day. I remember vividly the very first one. I had started my job at the NIH on that day. And this highlighted the urgent need to end the inequalities that drive HIV and AIDS and other pandemics around the world. The theme for this year's World AIDS Day is End Inequalities, End AIDS, End Pandemics. So 40 years plus since the first AIDS cases were reported, HIV still threatens the world. Today, the world is off track from delivering on the shared commitment to end AIDS by 2030, not because of a lack of knowledge or tools to beat AIDS, but because of structural inequalities that obstruct proven solutions to HIV prevention and treatment. As well as being central to ending AIDS, tackling inequalities will advance the human rights of key populations and people who are living with HIV, make societies better prepared to beat COVID-19 and other pandemics, and support economic recovery and stability. Fulfilling the promise to tackle inequalities will save millions of lives and will benefit society in myriad of ways. To celebrate or commemorate World AIDS Day and discuss some of these important issues, we are so pleased to have with us today Dr. Angeli Achrekar, the acting U.S. Global AIDS Coordinator and Special Representative for Global Health Diplomacy in the Department of State. Dr. Achrekar has dedicated her career as a public servant to global HIV/AIDS, women and girls' health, and global public health development. After working in India and later with UNICEF headquarters on adolescent health, she accepted a position with US CDC in 2001, where she focused on integrated adolescent health programs and services. Since 2003, Dr. Achrekar has been working on PEPFAR's global HIV/AIDS efforts, and in 2005, she went to South Africa to help local governments plan and implement a rapid assessment of drug use and sexual HIV risk patterns among injecting and non-injecting drug users and sex workers in 3 cities, Durban, Pretoria, and Cape Town. After serving as country officer for CDC, she became the senior public health manager, supporting cross-cutting system-wide sustainability activities and strategies in CDC's Division of Global HIV/AIDS. In 2011, she joined the US Department of State and helped lead the conceptualization and development of Saving Mothers Giving Life, as well as facilitating the implementation of this important program. For those of you who don't know about it, it was a public and private partnership that impacted maternal and neonatal health in the context of HIV service delivery. Dr. Achrekar holds a doctorate in public health from a very good program, the University of North Carolina, Chapel Hill. We love that program. We love our friends at UNC, but most importantly, she has her Master of Public Health from the Yale School of Public Health. So welcome, Dr. Achrekar, back to your alma mater.
Thank you so much, Dr. Vermund, and to the entire Yale community and the Yale University, but specifically a huge thank you to the Yale Institute of Global Health. I'm just so privileged to be here with you commemorating World AIDS Day that occurred yesterday. I have a few slides to cover and to share the experience and to provide an update on where we are globally if that's okay. So if I could start with the presentation to really walk you through commemorating World AIDS Day and talking specifically about the impact that we've had as a globe through the President's Emergency Plan for AIDS Relief. On the next slide, please. I always start every presentation by talking about how critical and instrumental the unwavering bipartisan congressional and presidential leadership of PEPFAR has been. We are 18 years in this fight through PEPFAR, which again started with President George W. Bush in 2003. Each subsequent president has picked up the mantle and really led and supported this program with an incredible amount of effort. We've also enjoyed bipartisan support across 10 Congresses over the nearly 2 decades of the program's life. Most recently, with the current administration, the Biden-Harris administration, I can't even begin to tell you how incredible their support has been. And I'm pleased to be able to talk with you in the next couple of slides here about how President Biden really leaned in, particularly on this recent World AIDS Day yesterday, but really how the administration has been leaning in and building upon the successes of all the previous administrations since. So on the next slide. Yesterday, President Biden hosted an incredible event at the White House where the domestic and global HIV community was brought together. Private sector, universities, Congress, faith-based organizations, activists. It was an extraordinary, in the US government, it was an extraordinary coalition of people, of passion that has been built over the past 40 years in this fight. As a part of his remarks, he announced PEPFAR's latest global results, which are nothing short of extraordinary. He announced that together, through PEPFAR with countries and communities, we've saved more than 20 million lives. We've prevented millions of HIV infections and helped at least 20 countries bring their HIV epidemics under control. This is extraordinary, particularly in the face of COVID-19, but just full stop, without a vaccine or cure, to have nearly 19 million people, women, men, and children on life-saving treatment, for example, is incredible. To have prevented nearly 28 million, or to have conducted nearly 28 million circumcisions in order to prevent HIV infections among men and young boys. Again, nothing short of extraordinary. Next slide, please. We have, over the years, supported population-based surveillance studies, household surveillance studies, to really validate results that we're seeing in countries. Here, we're seeing a somewhat of a busy slide, but what's important to note is how far countries have come in terms of achieving their 90-90-90 sustainable development goals. This is tracking the number of the percentage of people living with HIV that are aware of their status, and those that are aware of their status that are on life-saving treatment, and then those that are on treatment that are virally suppressed. So you can see the bars in terms of the positive, the percent positive, the percent on treatment, and then those that are virally suppressed in red, blue, and gray, respectively. What's important also to note on this slide is the percentage in orange, which is the community viral suppression. It's absolutely incredible when you look particularly at the left side of this graph here to see Botswana at 93, 98, 98 with 89% community viral suppression. Malawi, a very resource limited country, at 88, 98, and 97% with 84% viral suppression at the community level. Just extraordinary how far countries have come together with communities as a result of Americans' leadership and generosity in really working on this fight together. Next slide. It's important also to note that even in the midst of COVID-19, that PEPFAR has continued to not only maintain the number of people that we have on treatment, but we've continued to grow the number of people that we have on treatment, despite the peaks in COVID-19 transmission. So on this slide, across in color, you can see the number of waves of COVID-19 cases per million people in a select number of countries around the globe. And in red, you could see the number of individuals that have continued and grown on life-saving ART. Next slide. I also wanted to show here that we have had challenges as a result of COVID-19. These data show our circumcision performance over time, over a few year period. You can see where COVID in Q3 of fiscal year 20 really impacted the program, where the services dropped dramatically. This was intentional. We had made sure that we were doing everything that we could at the height of COVID-19 to really protect the people that we were serving, to keep them out of the way of infection from COVID-19. What we are seeing over time, however, is that with adaptation to the program, we've been able to rebound and stabilize the program over the quarters. And this is Q3 data, but shows that 70% achievement toward our annual target. Again, this is complementary to where we were in previous fiscal years. So again, we've been able to rebound, and this is really because of incredible work that has happened at the country level by extraordinary people and partners that we're working with, and real-time adaptation to the program. Next slide. And here it just gives you a sense of some of the prevention services and pre-exposure prophylaxis for adolescent girls and young women. Similarly, you can see a dip in our prevention services for adolescent girls and young women on the left side of the graph, but a stark increase after we started to really adapt the program and use different modalities to implement prevention activities. And with pre-exposure prophylaxis here, you see sort of a stabilization through COVID-19 when the impact really came. But the important thing here is a real steep incline through COVID. This shows us some of the preferences that the people we serve have. And so PrEP is something that we're really actively trying to scale up, not just for adolescent girls and young women, but all populations. Next slide. Over the while we have been a categorical HIV-focused program, and we've been working to sustain through COVID-19, sustain those HIV gains, we have been pivoting and adapting to really respond in the wake of COVID-19. We often talk about the PEPFAR platform, and what does that mean? Well, what we've learned over time is that all of the effort that we've been able to do in partnership with countries, communities, and partners over the years on HIV services and delivering HIV services has effectively created a care delivery platform that has, yes, been instrumental to HIV, but has also recently been instrumental to responding to COVID-19. We have thousands of US government teams from the various agencies, CDC, USAID, Peace Corps, the Department of Defense, all of the NIH, all the various health and human services, operating divisions, and others. We have strong local implementing partners and trusted relationships with partner governments, all in 55 countries around the globe. These relationships, these people, these partners, together with the incredible health system infrastructure investments that we have made over the course of PEPFAR's life, which is really been expressed as over $15 billion, but tangibly resulted in over 3,000 laboratories just on the continent of Africa that have been established and networked, including reference laboratories. Over 70,000 healthcare facilities in which we work with direct access to clients, as well as granular data at all of these facilities. Nearly 300,000 healthcare workers that we have trained on HIV, doctors, nurses, community health workers, epidemiologists, laboratorians, et cetera, and a robust commodity supply chain that is in place. It is this system, this platform that has been critical to respond to COVID-19. Since COVID really hit, the globe in early 2020, we've been adapting our program and leveraging this platform to support COVID-19 screening, diagnostics, infection prevention and control, demand generation for vaccination, as well as administration of vaccines themselves. I think Secretary Blinken said it best when he was recently in Africa on a couple of weeks ago, where he said, PEPFAR has saved millions of lives, brought the world to the edge of the first AIDS-free generation, and transformed public health infrastructure, where the investments we made years ago in labs and clinics formed the backbone of this nation's COVID response. And he was specifically talking about Nigeria, but this is true across the board. Next slide. And the president himself yesterday during the World AIDS Day ceremony said it again with his words: by strengthening countries' abilities to fight AIDS, we've also improved our collective ability to fight other diseases. And we couldn't agree more. Next slide. So as I noted, since early March, I would say, or late February 2020, we have been adapting the PEPFAR program and providing technical guidance on how we can lean in to leverage the PEPFAR supported health systems and infrastructure. And as I noted, to do everything from COVID-19 screening and diagnostics, and now all the way to vaccination. Next slide. One of the things that we did at the outset when COVID-19 first hit was really make sure we can protect the HIV gains. We did a number of things to ensure that we were focused on person-centered care to protect the populations most at risk for poor COVID-19 infection outcomes as well. So things that we implemented with urgency was, making sure that people on treatment we had absolute connection with them, tracking methodology, platforms in place so that we can ensure that their treatment was uninterrupted. We rolled out multi-month dispensing in a matter of weeks. This is something that we have been at with country governments for years, but it wasn't until COVID-19 that country governments realized the importance to move quickly to ensure 3 and 6 months of drugs for stable clients. This was a way to decompress facilities and also make sure that we were reducing the potential exposure of COVID-19 to people living with HIV. We decentralized drug delivery. We went closest to home, closest to the communities where the people we serve are. We used virtual platforms, telemedicine, and other ways to communicate with beneficiaries of our programs. A lot of the prevention programming that we had traditionally done in person in group settings was not possible during COVID-19. And so we were able to adapt and institute virtual platforms quickly. And I can't say enough about empowering communities and how important communities and local partners have been in this fight, but particularly through COVID-19. Community-led monitoring to ensure quality services and leveraging community health workers has been absolutely critical. Next slide. This is just an example, wanted to show some data of the rapid increase in the percentage of people living with HIV that were on ART comparing fiscal year 20 quarter 1 data to fiscal year 21 quarter 3 data. And these data reflect though the multi-month dispensing that I noted earlier. You can see when you look at the left side of the graph compared to the right side of the graph, the increase in 3 to 6 months of drugs for stable clients. So again, country by country, you can see a real increase in shift from toward, I should say, more months of drugs. And this has been a saving grace in the wake of COVID-19. Next slide. We've been so grateful that the Congress and this president appropriated additional resources specifically for us to respond to COVID-19. We received $250 million to prevent and mitigate COVID-19 impacts on PEPFAR programs and beneficiaries. And I guess I should start by saying, I didn't say this earlier, PEPFAR is a tremendous effort implemented in 55 countries, but over the past 18 years reflects $100 billion of American taxpayer dollars in this enormous global HIV response. So, but that was focused on HIV specifically, receiving $250 million to really focus in on utilizing the system and the platform we have in place to really respond to COVID-19 has been critical. So we were pleased to be able to program these resources quickly so that we could continue to utilize the platform to help respond specifically to COVID-19. Next slide. I wanted to provide a couple of country examples, and these are hot off the press as of 7 a.m. this morning when we had a global call home with all of the 55 countries to really talk about how we can and should continue to lean in and utilize the PEPFAR supported platform to help in COVID vaccination in particular, particularly with the recent variant and the need for us to really mobilize quickly. This is an example from South Africa with their ongoing COVID-19 vaccination support. And these are just examples of ways that we are bringing both of these efforts together, the HIV response and the COVID-19 response, to be nimble and to be impactful as COVID-19 continues to rage on the continent. So we're doing everything here from supporting the healthcare workforce that is doing everything from data capturing to vaccination in arms, as I said earlier, to procuring equipment and protective equipment, vaccine consumables, freezers, ways to support vaccine delivery, transport and logistics support. Data systems are absolutely critical, including support, supporting the National Department of Health and working together. So again, these are ways that we are bringing these efforts together. On the next slide. And here's an example from Zambia. Really important and critical work that they've been able to do, focusing in on PEPFAR supported facilities where that are focused for delivering antiretrovirals to people living with HIV. So a real intentional focus on vaccinating people living with HIV in existing ART clinics. And so what they have seen in a matter of weeks really is a focused effort in these ART clinics in high burden areas in Lusaka. In a week, we're able to vaccinate 1,000 people living with HIV. Again, and that mushroomed where other facilities across, now over 500 facilities across all 10 provinces in Zambia are rolling out this program really pushing COVID-19 vaccination for people living with HIV, as well as family members and others that accompany them. The Ministry of Health was so thrilled about this that they issued a circular, which is, there's a picture here in late August. They issued a circular expanding this policy and this effort across all 10 provinces. So we're really excited about this and looking forward to what might be able to be achieved by bringing these efforts together. Next slide. And again, they used the opportunity of World AIDS Day yesterday to really bring together a COVID-19 vaccination surge with World AIDS Day activities. So bringing a really high level push from the government of Zambia together with the US government to see what might be possible by the end of this fiscal year, or sorry, by the end of this calendar year, by bringing a real push for COVID-19 vaccination. Next slide. There are, of course, challenges and opportunities to sustaining epidemic control of HIV. And as I noted and showed in the population-based surveys, there are countries that are getting that new infections are continuing to drive down and all-cause mortality is being driven down as well. Countries are beginning to control their epidemics. But there are challenges, including inequities that continue to persist among adolescent girls and young women, key populations, and children. And these are areas where we are trying to double down. COVID-19, of course, continues to persist, and this is something that we need to continue to proactively get ahead of to ensure that we're not just protecting the gains in HIV, but continuing to advance and accelerate those gains in the midst of COVID-19. And there are real opportunities to tackle some of these inequities by working differently across sectors, by really bringing a refreshed perspective to how we're disaggregating data across younger and more specific populations, for example, to drive where our investments go. And then again, utilizing the platform in different ways to help respond for the future. Next slide. There are some elements about what a sustained response to epidemic control of HIV might look like. And it really has to do with equitable health services and solutions across the board. But there are elements that include a whole of domestic approach between the governments, the partner governments and communities, enabling policy and programmatic environments that remain barriers to services, but that having these in place are absolutely critical. Sufficient functional capacity to maintain these programs and these services. Financial sustainability is essential as well, domestic resource mobilization, and then integrating HIV services into the broader public and private care delivery systems to really ensure that when we have a country at epidemic control of HIV, that we are really ensuring that control, which is a very dynamic place, remains in control. And so ensuring that a robust public health response to monitor and track existing and emerging threats becomes even more critical, as does quality assurance. Next slide. Just a couple of slides on finances, HIV investments by funder. This slide shows by country on the right side of the graph, the percent contribution from PEPFAR, the US government, in blue, the Global Fund, which the US is a big contributor to, and then partner governments in gray. And we continue to work seamlessly across partner governments, the Global Fund, and with the US government to make sure that our investments and services complement one another. Next slide. But we continue to be concerned because of COVID-19. When we look at the projected gross domestic product growth versus HIV prevalence rate as seen on this graph, you can see economic problems from COVID across the board, but are pervasive and worse in countries with high HIV prevalence, as noted in the red dots on the right side of the graph here. Next slide. One approach that we've been utilizing is sustaining delivery of HIV services through local and community partners. This has been an approach to sustainability that we have been trying to employ for a number of years now, and we're seeing significant gains and movement in the right direction here, where we're really working to make sure that funding is going directly to local and community partners themselves. As you can see in the graph across the country, some countries have over 80% of their funding going to local partners. And it's not just the funding, it's ensuring that the local capacity and capabilities of these partners exist to implement services in the respective countries. Next slide, please. Just a couple of final slides here, just to note that we're really bringing an equity lens to the effort to complement our work on accountability, transparency, and impact, to really make sure we're closing those gaps that I noted earlier. And on the next slide. And I'll stop here, which is we've been working with many of you and others across the globe to develop a PEPFAR strategy for the next 5 years to help guide our efforts moving forward. And these really relate to accomplishing the mission, finishing what we started, building enduring capabilities, as I noted earlier, how critical health systems, enabling environments, and local partners are, and finally, building lasting collaborations. Next slide. And with that, I'll just say thank you and turn it back over to you, Saad.
Hi. Dean Verman was, started the event hosted the event on behalf of Yale Institute for Global Health. Unfortunately, he's in transit in the Dominican Republic. So while he is connected, I will be filling in for him for the question and answer sessions. Would be happy to field questions from the audience, as well as a few other questions that we have been thinking about. So first of all, thank you for a really nice talk and a comprehensive overview of the progress of PEPFAR and what are some of the things PEPFAR has been doing lately. And those of you who don't know me, I'm Saad Omar. I'm the director of Yale Institute for Global Health. So, the first question actually came from our participants, our audience, and I think it's very timely in the context of the overall environment, because there was very strong bipartisan support for PEPFAR when it was first launched. Do you still see that support?
Thanks so much, Saad. I have to say, you're right. When PEPFAR was first launched, there was incredible bipartisan support, across the U.S. government, with President George W. Bush, who was extraordinary in launching such an incredible effort, but also across the Congress, from Republicans to Democrats. There's something magnificent about the HIV fight. It brings all walks of life together. And what we've seen over the years, in the past 18 years, and what I noted in my presentation, is that every year since, every administration since, and every change of Congress since, they have equally come in and brought, stood on the others' shoulders and really continued to bring the highest level of congressional and presidential bipartisan leadership. And as I noted, most recently with President Biden, it wasn't just with World AIDS Day, where the enormous support and leadership of the global response was displayed. Since day one of this administration, President Biden and the administration has really put their arms around this issue, supporting all of us and the effort and the fight in every way that we have come together in the multilateral space. There was the UN high-level meeting this summer that happens every 5 years, where the administration showed full support, but all the way to the way the budget looks, to the way, again, the political leadership as well. So, they've also recently announced that the US will host the next replenishment of the Global Fund to really make sure that we are advancing our efforts for HIV, TB, and malaria around the globe through our multilateral efforts as well. So the bipartisan support has been critical. It's been maintained and grown over the years, and we're incredibly grateful for that.
Well, that's wonderful. So the second question comes actually from Dean Berman, and he raised an interesting point that it's obviously really good to see that PEPFAR has aided in the COVID-19 response, and especially the in-country infrastructure has been repurposed, utilized, and by the way, not for the first time for a major public health emergency. Can you comment on other expansion of mission, as with the non-communicable diseases? And people have sort of strong opinions on that. One is that it's a no-brainer that you have built that infrastructure, and there's this this emerging and important issue of non-communicable disease. But on the other hand, there's this instinct a few people have, is to preserve the capacity for a purpose that it was created. So we'd love to hear your thoughts about expansion to NCDs.
Yeah, no, thank you for that important question. And as you're right in that the PEPFAR platform hasn't only been utilized for COVID-19. There have been so many ways over the years, whether it's other infectious areas like Ebola, or when H1N1, SARS, MERS, so many other areas. But we've also been utilizing the platform to respond to TB, to respond to cervical cancer, and so those are examples of how we've expanded to help really move in the direction of non-communicable diseases. I think the question is a really good one, because there is a very delicate dance that we have to do in order to make sure that we don't dilute our efforts in HIV while we do what we know is the smart thing to do, which is to utilize capacity that exists to help respond. And so that's why we've been very deliberate and careful about how we've been responding to COVID-19, for example. Tying it to looking at the data and making sure that we are doing everything to preserve the HIV gains while we've been able to expand as we've needed to. I think, I think we would be, look, we haven't finished the fight yet. And that's why I mentioned, there are gaps that persist, and we've got to close those gaps for HIV. But we can't also ignore the fact that there is this incredible system that exists. And whether we like it or not, countries realize and see the power of the systems and capabilities that are in place, and see the need to be able to bring synergy together. So, my thought is, we need all ships to rise. We need to utilize that platform that exists, because starting from scratch doesn't make sense. But we've got to be able to do it in a very careful and considerate way, so that the outcomes that we've been able to achieve together on HIV don't backslide.
Yeah, and we got a sort of a related question saying that, obviously, we definitely don't want to lose the progress that we have all made so far, and diversify the HIV/AIDS funding sources to address the COVID-19 pandemic. So, as someone who sort of has run this kind of a program of this magnitude, do you think there's a need for a new fund, or some sort of, another entity or a resource for COVID-19 and future pandemics, because we don't have to have a pie of a fixed size. We can increase the size of the pie itself. Public health is extremely cost efficient. We get really high returns on investments. But do you think there is a value in a separate fund for pandemics, for COVID-19, or something of that sort?
So, the global health architecture and what the future looks like is a hot topic of conversation, as I'm sure you're very well aware of and immersed in. And I think, and part of the reason I showed what was possible with $250 million of the American Rescue Plan funds was that with a relatively small amount of money, $250 million in our $6 billion a year program, how much we've been able to do because we have systems and capacity and infrastructure in place. So I guess setting up a fund specifically for pandemic preparedness and response, there's certainly a different skills. There's a broader skill set that needs to be brought to bear that is not solely in the HIV sphere, but the time that might be involved to do something like that when we're in the midst of two pandemics right now, HIV and COVID-19, and being able to respond quickly, that's only possible with infrastructure that is on the ground and capacity on the ground right now to mobilize quickly. And so I guess that's the long way of saying, I think a fund, I think a separate fund, again, we'll see where the conversation of global health architecture falls. But there's definitely something to be said for building on investments that have already been made, because that's a fast, efficient way to work.
I think, and of course, we'll have to think about the horizontal versus vertical nature of programs. Obviously, there are trade-offs there, on both sides, or sort of the diagonal nature of some of these programs that are sort of hybrid between vertical and horizontal programs. So, do you think now is the time for a PEPFAR level effort specifically? So, not necessarily PEPFAR, but a vaccine distribution effort that is of that scope. So, some of us call for it like in March of 2020. So yes, we have discussed that there is this, the issues of a separate fund, but it's more long-term, etc. But more immediately, do we need something of that magnitude for this problem that we have right now, where we need an end-to-end solution?
Yeah, no, thank you for that question. It's such an important one. And again, in the same way that President Biden has really expressed tremendous support of the global HIV response, we were so pleased, and I hope many of you participated in or have been tracking the global summit on COVID-19 that occurred around the UN General Assembly in the fall, where the president, really tried to mobilize the world to step up on vaccination across the globe. Putting bold targets out there, of 70%. Trying to get the coverage rate to 70% across countries, and what that could look like, and how we as a globe, not just the United States, but we as a globe need to sort of collectively move in this way. So and we've since had some follow-up ministerials to really try and urge, the vaccine delivery and administration. The U.S. has been donating, hundreds of millions of vaccine. One of the concerns that we have And I'm just, giving an example from the African context, is there's a lot of supply actually right now in many of the countries. One of the main concerns is much of what we face here as well, hesitancy, actually getting vaccination administered in a timely way. We're seeing some waste of some of the vaccines. So these are questions that are also being considered.
So, look, you have a particular strength as a leader because your own background includes a lot of work in the field itself. And I hope we sort of nurtured some of those values and attitudes here at Yale at an early part in your career. But what do you think? How has that informed your leadership style as you have sort of risen to sort of leadership positions within the program itself? And is there any insight that you can share with our students from that perspective? Someone from the field, of someone who has gotten their hands dirty, someone who hasn't been dropped into an agency as an appointee with a lot of other assets, but not necessarily field experience. But you have direct field experience. Any insights?
Well, I so appreciate that question, and speaking directly to the students at Yale. So on a personal level, let me just tell you a little bit about why why I chose Yale, and why Yale and the comprehensive approach of the public health program, the global health program in particular, was so instrumental in forming me in my career, in my service that I've since been doing 20 plus years since. What was extraordinary then, 20 plus years ago, when I was a student there as a master's student, and what drew me in, and what I know is still consistent at Yale, is the comprehensive multi-sectoral approach of the global health effort. When I first started, it was brand new. It was a newer, field, a newer part of the program. But what I loved about it was how we, at the time, had professors and opportunities from the medical school, from the business school, from the, there was a multi-sectoral approach that was absolutely critical. One of the experiences that really changed my world was what many, I don't know if this is still part of the curriculum at Yale, but the summer between first and second year of the master's program, when there was some sort of internship type work, that's when I went to UNICEF to start that, to do my internship, and that turned into a love of this work. That then turned into going to the field. That then turned into time in countries, and that began my love for this work and for the service that I've done as a career public servant. As you noted, I'm not a political. I have been in the government and experienced some of the real struggles and issues that people face in communities all around the globe, and to be a part of something, no matter how big or small, something that is really making an impact on their lives is the greatest honor of my lifetime. And so it's just, it really did start with that approach that Yale instilled in me, of service, of experiencing the field and translating science and research into real public health impact. So Yeah.
So that's wonderful to hear. And you'd be happy to know that the Yale Institute for Global Health has actually formalized a global health leadership fellows program that is open to any trainee and student at Yale, from undergrad to actual postdocs, research and clinical, and everyone in between, including graduate students, et cetera, that has a formal pre-departure component. Then we place them in global health agencies like UNICEF, as you did that, Save the Children, and many others. And then we'll expand to ministries of health as well. This is in addition to field placement programs. This has a specific focus on leadership and service, particularly public service. And so that program has expanded, and it's good to know that these kinds of investments pay off. So this particular program is new and expanded, but the earlier efforts have, I think I can say confidently, has had a high return on investment. And so in terms of going back to a little bit a focus on partnerships that you mentioned, specifically thinking about how faith-based organizations can be leveraged to help with HIV/AIDS, stigma, prevention, and care, and what are the new frontiers? I know that PEPFAR has, from the beginning, collaborated with faith-based organizations, but what are the new directions in that kind of partnerships, and what are some of the lessons? Because look, other sectors, other entities will have to partner with faith-based entities and organizations from the grassroots to the global level. And some lessons from PEPFAR would be very would be very useful for those sectors as well.
Yeah, no, it's such an important question, and an important sector that is critical to the response. I mentioned earlier in my remarks that there's something extraordinary about the HIV fight, and that it brings so much diversity, so many sectors together. Everything from, and part of that is the bipartisan support from Congress. Just as many Republicans as Democrats love this program. We have the most conservative religious groups that have equal, have critical roles to play in the response, as the most liberal, NGOs or LGBTQI plus organizations. Our advocacy groups are so broad. So again, there's something beautiful about the global HIV fight that has brought so many people together. Faith-based organizations, as you noted, Saad, faith-based organizations have been critical to this response from the very outset. And I talked a little bit about local community organizations, and I include faith-based organizations in that broader, subset. Faith-based groups have been there in these countries before we were there. They have access to people in ways that we absolutely need to talk about some very sensitive issues like stigma and discrimination. Today, I mentioned, we were on with all of the country offices, and we were talking specifically about involving faith-based organizations in COVID vaccination for people living with HIV, because there's a real hesitancy among pregnant women living with HIV, and their hesitancy about COVID vaccine and the impact that it might have on their child. And so, the conversation was around, well, how do we involve faith-based organizations that are trusted, institutions in many of these countries, and that have influence in so many different ways. So again, I think they have played, they continue to play, and they will always be needed in the response.
Wonderful. And the last question is, many, and I think I know who asked this question from our audience, someone with a sort of a significant student role. The question is, many in our audience are students that aspire to work in global health. What is your advice to these students as they consider what to do after Yale? I know you have alluded to some of that stuff, but I think I'd love to end on that note.
So what to do after Yale? Well, the good news is you're getting a really incredible experience while you're at Yale. And I would encourage you to seize all of these opportunities, including that new or the fellowship that you were describing, Saad, the way you've institutionalized that field experience, because that's really exciting. You know, I would encourage you to be open and flexible. You know, part of it's amazing how, oftentimes as I reflect back now, oftentimes there's never a direct route to where you're headed when it comes to your career. But there are experiences that if you're open to seizing, it could move you in a way that really compels you to focus. And that's what happened for me. There was a incredible opportunity. It was a fellowship at CDC that was specifically focused on integrating services across and this was domestic, but across the education and health sectors. And that intrigued me because of a lot of the work that we were doing in the global health space of bringing different sectors together. And that's one of the things I learned at UNICEF when I did my internship there. And that intrigued me. And so I applied and got that fellowship, and that set me on a course that in terms of integrating across sectors and integrating services for adolescents. And that has then evolved. And again, I just being flexible and focused on the mission on service that you're compelled by and inspired by, I think really helps move forward. But also reach out to people that you know that are in various places as well, because we are always looking for good people to join our teams.
Wonderful. Thank you. And as you alluded to, that PEPFAR, and I think if I can say so, PEPFAR reflects the best of America. Bipartisan, with empathy, with adequate resources, bringing in good, solid technical expertise, but at the end of the day, partnering with communities and countries and working as true partners rather than parachuting in solutions, and having long-term commitment. So I hope PEPFAR remains that example, but doesn't remain the isolated, I wouldn't say rare, but one of the few examples of this country making solid investments in global health that results in this win-win situation. And I'm sure it's been a privilege for you as well, I hope, to lead this incredible program in the recent past. So thanks for coming, and thanks for your words and engaging us in this conversation.
Thank you so much, and thank you for the opportunity. And it really has been a privilege of a lifetime to be a part of something that has really been a movement around the globe. So I am just so grateful to have been with you today and shared how some of my roots there from Yale have helped contribute to who I am today and the service that I've been so privileged to provide on behalf of the American people. So thank you very much.
Yeah, thank you. Thanks for coming, and thank you for all of you who joined us today. We look forward to seeing you at the next event of YGH Conversation Series in early 2022. We have a pretty exciting program brewing for you. and happy holidays.
Thank you.